I'm Paymon Sanati-Mehrizy. I'm a plastic and craniofacial surgeon at UT Southwestern, and welcome to Ask the Experts. Cleft lip and palate are the most common congenital differences that children are born with. We see it as often as 1 in 700 children can be born with this facial difference. We get started right from birth, and oftentimes we even meet families before their children are born to talk a little bit about what cleft lip and palate care looks like, which includes surgery, but also care from a lot of different specialists at our center. Cleft lip and palate oftentimes can be inherited, but it's really a multifactorial inheritance pattern. A lot of times we don't know why a patient might end up with that, but we do see that if a family member or if a grandparent has a history of clefting, a child may have an increased frequency of having a cleft. And once you have a cleft member in the family, the rates of future children developing cleft also goes up. But it's really oftentimes unknown. So cleft lip and palate come in a really broad spectrum. You can have pretty mild form of clefting, which could be a simple notch just at the edge of the lip. Or it could be what we call a complete cleft lip, which extends all the way through the lip up into the base of the nose. And then same thing with the palate. So the palate may have a very minor involvement, or it can be a complete cleft palate. The true way to get a good diagnosis is with physical exam. So the first thing that we do when we meet these families is that we'll do a thorough examination to see how involved the facial clefting is. And based on that, we can come together and form a treatment plan for the patient. The primary treatment for facial clefting is surgery. Patients who have cleft lip and palate oftentimes will end up getting 2 separate surgeries in the first year of life. For patients with a cleft lip, we're often doing that first lip repair around 3 or 4 months of age. And with patients with a cleft palate, we'll often repair that palate around 9 or 12 months of age. And these patients, as they get older, oftentimes will need additional surgeries to address other portions of the face. And that's why they remain a member of our team, because we see them back once a year to decide when's the right time to do the next operation. So here at Children's and UT Southwestern, we have a multidisciplinary care team that helps to take care of all of these patients. Our team involves a lot of different specialists, so we have a total of 4 cleft and craniofacial surgeons. Together, our team focuses on really taking care of the patient in a harmonious way that's addressing not just the surgical needs that they have, but any other needs, including supporting the families through the process. When you have a newborn with facial clefting, it can be tough to figure out how to feed them appropriately so that they can gain weight and grow. That's why our craniofacial nurses get involved with our speech therapists and our nutritionists. Together, they can help guide families on finding the right feeding mechanism, but these members of the team are really the experts in cleft feeding. Ultimately, by doing surgery, a lot of times that will improve their feeding as well. The next thing that we think of is the cleft palate as it relates to speech. So the palate is a dynamic structure. There's muscles in the palate, and the palate moves. When you're speaking or when you're swallowing and breathing, the palate has specific movements that it does. And if a palate is clefted, the patient's not able to do that correctly. So one of the goals is to repair the palate in order for a patient to have developed normal speech. So our team helps to take care of patients until their late teenage years. The majority of our patients at the Children's Hospital are with us until about 18 or 19 years old. Once they're finished with our team there, our goal is to set them up to be ready to take on adulthood. The truth is, though, many of these patients still need a team to take over their care once they become adults. And our goal here at UT Southwestern is to provide them a center where a patient with a cleft or craniofacial difference can sort of naturally transition over. So now, with the creation of this team, our patients can transition over here and ensure that they have somewhere to go with any of their cleft and craniofacial concerns. The team that's present here, that's a partnership between UT Southwestern and Children's Medical Center of Dallas, is the busiest center in the region. And our team really focuses on that holistic, multidisciplinary approach, where it's not focusing just on surgery, but we're focusing on all the different facets of care that these patients need to ensure that they're getting really the best care possible. The surgeons that take care of these patients just do cleft and craniofacial care. We're all just pediatric specialists. This is what we do every day, and that's really what we're passionate about. And so we feel strongly that our patients can get the best care at our team.